Hello everyone, my name is Haley Beal and this is my presentation on healthcare and nursing philosophy, kind of what that looks like to me. I have spent the last 2 years in a medical surgical intensive care unit in Portland, Oregon. So nursing and healthcare, it's one of the vital facets. We work as part of a multidisciplinary team. We do our work with other nurses, nursing aides, physicians, physical therapists, occupational therapists, speech, pharmacy, etc. We work with many people throughout the course of our days that are all very vital to the care of the patient, but of course we are there as bedside nurses with the patient for the majority of the time. Because of that, bedside nurses are often linked between the physician and the patient. So it's kind of the in-between of knowing the patient's status moment to moment and being able to advocate for the patient for what they need to the physician, as well as discussing plan of care and plans with the physician and just the middle person between those two. Nursing to me is the profession of caring and advocacy for patients, including health promotion and prevention of diseases, both autonomously and with collaboration of other medical staff. So I really believe we all went into this profession because we are caring people. We intend to do the best we can for our patients and truly advocate for what they want and what they need. This includes both promoting healthful processes as well as preventing diseases and treating them. And we do that both on our own accord and also in combination with the other medical parts of the team that I mentioned a little earlier. Nursing to me, it's not just a profession, it's also a way of life. I think it really has taught me both how to care for myself as well as how to be more present and care for my friends and family in my own life. It also definitely structures your time. Nursing schedules for bedside nursing is often a little chaotic and random, and that's what we structure our life around. It's also constant learning, constant growth in this profession. I think we're lifelong learners and it just never stops. Like, you will never know what you're going to learn when you walk into work. And it could be something from physicians or a patient experience you have or another nurse, or just discovering something that you didn't know about an illness that you thought you knew really intimately. So it's just always up in the air of what you're going to learn and how many things you're going to learn that day. I think it definitely requires mental, emotional, and physical commitment. Nursing can be very mentally and emotionally taxing and also physically tiring if you're lifting your patients and repositioning them and kind of helping them get up and down throughout the day. Nursing in society. So we contribute to society by caring and supporting patients and their families by allowing them to have the education and resources necessary to make well-informed decisions in their healthcare choices. I think kind of similar to the way that we're a link between patients and physicians, we're also a link to being that education that patients and families need to become informed healthcare decision makers. And especially as nurse practitioners, we can play even more of a pivotal role in that. And that's really our responsibility to make sure that our patients do know and understand everything that they need to make informed decisions. I believe some qualities of effective nurses are being kind and empathetic. Having a good sense of humor, I think, is crucial, especially when you've had really hard days or even a hard stretch of days in a row. I think it can be good motivation to have a good sense of humor amongst yourself, but also within your own unit of nurses. Being well organized, and with that being able to prioritize your time. I know we've all had shifts where you go in and you're super organized and everything's going great, and then something just snaps or goes wrong, and you just have to prioritize that and kind of take it as it comes. Being a critical thinker and being able to stay calm and collected in emergent situations is very important. An ability to work well with others, both with other nursing assistants and nurses, but also with the other multidisciplinary team members. I think there can be difficult people to work with no matter where you are, but it's even more important in healthcare that you're able to build those relationships and communicate effectively and really understand where other people are coming from so that you can make sure that you're really providing your patient the best care that you can. And then, like I said before, just being a lifelong learner. Values in nursing, I think, really depend on the individual, as we kind of saw the first week of class. I think we all had our values probably pretty well defined before going into nursing, and then nursing just challenged them and continues challenging them, and it really makes you reevaluate and redefine your values and kind of solidify them down, and then your actions will be based off of those values. And I think even if you think you know your values, nursing will ultimately find a situation that tests it out, and it's really interesting to see how values and ethics kind of grow and not change, but just become more centered over time. Thank you.